Welcome to the Natural Super Kids podcast, where you will discover practical strategies to inspire you to boost the health and nutrition of your kids. I'm Jessica Donovan, a qualified naturopath specialising in kids' health, and I want to make it as easy as possible for you to raise healthy and happy kids. Let's get into it. Hello. Welcome back to the Natural Super Kids podcast. Jessica Donovan here, and I am excited to dive into today's episode with you. We have an amazing guest. I could have spoken to him for hours and hours. What he shares is super valuable, and we are chatting all things gut microbiome testing. We dive into, exactly what gut microbiome testing can tell you about your child's, not just their gut and their digestive function, but their overall health and well-being. This is something that we do a lot of with our one-on-one clients here at Natural Super Kids, and Brad is just a wealth of knowledge when it comes to gut microbiome testing for both children and adults. So our guest today is Dr. Brad Leech, who is a PhD qualified clinical nutritionist and herbalist, specialising in chronic autoimmune conditions and complex gastrointestinal disorders. He provides complete and personalised care to his patients using functional nutrition, integrative medicine, and holistic wellness. He was such a delight to chat to. Brad is also the lead clinical educator at Co-Biome by Microba, where his expertise in gastrointestinal healthcare enables him to translate the latest science on the gut microbiome into practical clinical applications. And Co-Biome is, the test that we commonly use for gut microbiome testing here at Natural Super Kids. So, a lot of what we are talking about is really relevant to the gut testing that we use as practitioners here at Natural Super Kids. So I think you're going to love this conversation. As I said, Brad is a, delight and shares his wealth of knowledge in a really easy to understand way for parents. So I hope you enjoy this conversation. Welcome to the Natural Super Kids podcast, Dr. Brad Leech. It's so great to have you here.
Jess, it's a privilege to be here, and I look forward to chatting all about the gut health and the microbiome.
Yes, my favorite topic, and I'm really excited to dive into your knowledge. So, we want to kind of dive into microbiome testing because there's a lot of kind of questions that our community have and maybe some misconceptions and confusion as well. So let's start by, if you just want to introduce yourself and tell our listeners a bit about you and how you came to be specialising in this area.
Yeah, definitely. So I've been in clinical practice for I think it's about 15 years now. One of my first degrees was in traditional Ayurvedic medicine, so the medical system of India. I actually dropped out of school at the age of 15 and I went on to study an advanced diploma in Ayurvedic medicine. So I dropped out and started studying. I knew exactly what I wanted to do, and it was what I am doing right now. And I spent the better part of 12 years just advancing multiple different degrees, a PhD. And so I've had a lot of experience with gut health and also autoimmune disease. So I actually thought that I would specialize in autoimmune disease. And so my honors and PhD, I investigated this concept called leaky gut. So leaky gut is where particular cells in the small intestines, they open up in response to different bacteria or gluten or stress. And I wanted to investigate this because there was this link with an increase in autoimmune disease. But as the years went on and I focused on this area of leaky gut, I became more and more of maybe an expert in the realm of gut health and the microbiome, to where I am now, where I mainly specialize in gut-related conditions and gut-related autoimmune conditions. But of course, I see everything from skin conditions to mental health and everything in between. But I love what I do. So I work in private practice, but I also do a lot of education. So I travel around Australia doing conferences and educational events talking about the microbiome and educating practitioners on, well, this is the microbiome. This is how we can use it to help inform what's going on in our patients. And then this is what we can do to help our patients improve. So very passionate about the microbiome. Absolutely love it.
Ah, yes. And I mean, it's links to so many different areas of the health, doesn't it? That's why I, as a naturopath, love, delving into the microbiome, because it can influence, obviously those digestive symptoms, but also, as you're talking about, the immune system, autoimmune conditions, allergies, and atopic conditions we so commonly see in kids, mood, behavior. It's this one place we can focus that can have that real flow on effect to so many different areas of the body.
I feel like I could link the gut to every system in the body. I could
Yes.
link it to bone health. I could link it to memory loss. Although it might be a very small link, I'm sure I can find the research from a clinical perspective or from a research perspective, making a link between optimal gut health and optimal systemic health.
Yes, definitely. I think we are we're like souls in that way, because I totally agree. So let's get into microbiome testing. Can you share what specific markers or bacteria will the gut microbiome test analyze?
And this is a great question because it's one of these questions I actually put back on my patients. I say, well, what do you expect to see in your microbiome report? And sometimes they go, oh, I don't know what it measures. I don't know what it tests. And other times you'll have educated patients go, oh, I think it might show low bifidobacterium or it might show methane. But put it simply, at our current level of understanding, we can measure over 28,000 different bacteria. 28,000. That is a huge number. Now, that 28,000, they're not bacteria or viruses or fungi which are colonizing the gut. That could be bacteria found in the stream. That could be bacteria found on, I'll give you an example, on a avocado farm. I had a patient with a very unusual species of bacteria. It's not seen within the gut, but we identified that it was actually from them working on an avocado farm. And I'm like, wow, we can actually see your environment within your gut. We digress. When we look at collectively the gut microbiome, so all of the different species, so all the different bacteria which could be in the gut, there's anywhere between 4,000 to 6,000 different bacteria that could be there. But on an individual level, on average, a healthy Australian will have about 200 individual species. So we can look at this as a scale. So a typical healthy Australian will have 200 species within their gut. I've measured my microbiome and I've got 275. All right, fantastic. I do all those things for optimal gut health. I have fermented foods. I eat a very diverse diet. I've never taken antibiotics. Where we can compare this to some of my most ill patients, and they've got fewer than 100 species. And that's where you start seeing a lot of problems starting to develop. And then I read this research article about a year ago now, where they measured the microbiome over in sub-Saharan Africa, some of the most diverse microbiomes in the world. And those individuals had 750 species. So maybe because, you and I, we're exposed to EMFs, we're exposed to cleaning chemicals and so forth, maybe that's impacting our microbiome and maybe we need to be living off the land a little more. So yes, when we measure a microbiome, so a microbiome test involves taking a stool sample, sending it off to a lab, and it will give you a report. We can look at these bacteria. One element that I love to look at when measuring the microbiome is this concept of diversity. And that's exactly what I've just told you there. How many species of bacteria are within a microbiome report? So that's what I look for first and foremost. Are there around that 200? Is there more than 200 and so forth? The next one I want to look at is this concept of microbial metabolites, right? So because there are so many different species of bacteria, which could be in a report, I do not have the time in my life to learn the 28,000 different species which could be there. I can't pronounce half their names. I can't remember everything that they do. So what is quite incredible is we're at this level of understanding where we can take all of their DNA capacity, we can look at the DNA of the bacteria, and we can go, what does that bacteria do? And we can understand what it does within the gut. Now, some bacteria are, in quotation marks, good, and other bacteria, in quotation marks, are bad. When we collectively look at all of the DNA of these bacteria, it will give us a marker called microbial metabolites or microbial markers. An example of this is going to be butyrate. So butyrate is what we call a short chain fatty acid. Not all bacteria will produce butyrate, but some bacteria will. So on a microbiome report, it will actually show us how much of the microbiome is actually producing butyrate. So we can say, is it low? Is it within range? Is it high? And it can give us as practitioners that understanding as to, do we need to address this? Do we need to increase it? Or is it actually fine? So butyrate is perhaps the most well-known of these microbial metabolites, but there are 20, 30, 40, so many other metabolites, little compounds that the gut produces. So we can measure, at the moment, with our current level of understanding, about 20 of these. I'll give you an example of a few others. Things like methane. So methane's a big one. Methane is a gas that is produced by some of these microbes, and it can slow down transit time, contributing to constipation. And we know in adults, we know in kids, constipation is a very real thing. And I see an overgrowth of these methane producing microbes quite a lot within clinical practice. And it pairs up quite nicely with those who have constipation. So we're making that link between what's happening within the gut and that clinical presentation. Another one is a marker called beta-glucuronidase. Bit of a mouthful, beta-glucuronidase. The reason why this is such a unique marker is when it comes around to hormones, right? A lot of my patients are, and I'm sure you can relate in your practice, are going to be females. And females generally have hormones. And sometimes those hormones can be out of balance. So things like endometriosis or PCOS, those imbalances, we can actually look at this marker, beta-glucuronidase, and get an understanding of whether or not there's reabsorption of estrogen within the gut. And it gives us clues as to, well, do we need to prescribe particular different fibers to support this? Is this driving up the clinical presentation of a estrogen dominance? So they're just a few different markers, but collectively, measuring the microbiome can give us information on intestinal inflammation, digestive secretion, so how much digestive secretions are coming from the gut, motility, so whether or not that's fast motility or slow motility, so diarrhea, constipation, also things like systemic health, like systemic inflammation. And of course, we can evaluate things like leaky gut, whether or not there's any permeability happening within the gut.
Yes. Oh gosh, you've explained that so well. And, so many of those examples that you gave are things that we commonly see come up on gut microbiome tests, like, that the short chain fatty acid metabolites that you were talking about, the butyrate, obviously. We see a lot of kids, so kids that are quite fussy, they're not eating all of those prebiotic fibers. And so, yeah, just you've really pinpointed the different like little clues that as practitioners we can get from these tests. And again, like how the gut microbiome links to those different areas, the constipation, for example, the hormones. So thank you for explaining that so well. Can you share a bit more about how comprehensive the testing is in identifying potential issues in clients, whether they're children or adults?
And I think this comes down to clinical experience.
Mm-hmm.
If you gave the same microbiome report to a novice practitioner who may not specialize in this area, and then you provide it to an experienced practitioner, they're going to come up with very different answers, different solutions. And so I think clinical experience is one thing. Hypothetically, you've got a very advanced practitioner and you provide them with a microbiome report. It can provide clues as to what's going on. And I think the big one here is a microbiome report. So just looking at the bacteria, not other markers within the gut, but just looking at the bacteria, you can't diagnose a health condition. So we can't go, oh, you've got this one bacteria, you're going to have autism, or you're going to have cardiovascular disease. We can't make that link because of the level of research. So within the research, we have what's called cross-sectional data. So that is where we evaluate the research at one point in time, and we can make an association and maybe even a correlation in relation to, we might stick on this ADHD, autism type of conditions where researchers have seen a link between individuals with autism and particular bacteria. But, and I'm gonna say this because I am a researcher, we can't make a diagnosis based on one or two different bacteria. It may serve as a clue to us as practitioners to say, oh, there are these particular species that are associated with these particular conditions. I really like to use the rule of three. When there's three things indicating that this is the problem, then maybe it is. So if we've got a neurological assessment, we've got a behavioral assessment, a microbiome assessment, other clinical assessments to indicate, or maybe this patient has autism and maybe it is driven by the gut, then possibly. But we've really got to be cautious on overstepping that diagnosis and assumption based on the gut. Sometimes I have parents and I have patients come to me and they go, does my child, or do I, as the patient, have this particular species? And I try and educate them. It's not about a particular species. It's about collectively what's happening within the gut. It's about the whole microbiome rather than one particular species, because I guarantee it's not going to come down to one particular species. In saying that, of course, there's going to be bacterial infections. And an example of this is going to be like E. coli, or let's say food poisoning. Yeah, food poisoning will be found on a microbiome report, and you'll be able to clearly identify it, and it'll say E. coli, and you go, yep, that is the cause of your watery diarrhea. I have no problems making that link, but that is a pathogenic infection. That's a true infection. So I really feel that a comprehensive microbiome test can help us identify clues. It can lead us into treatment direction. It provides us with clues as to what we need to do. And that is what I tell a lot of practitioners that I mentor and I educate. It's about informing treatment. It shouldn't purely be about treatment, should not be purely based on a microbiome report. We've also got to consider the patient sitting in front of us. But a microbiome report can give us clues. I'll give you the example of constipation and methane that we alluded to earlier. If the patient comes in with constipation, yeah, I'm going to evaluate their microbiome to see whether or not it's methane related. And if it is methane related, I'm going to prescribe different interventions to bring down that methane. So yes, it does come down to how comprehensive a microbiome report is, clinical experience, but it gives us clues. And it's almost like we are investigators. And where we sift through the microbiome report going, this particular marker might be linked up with this clinical symptom. And then we pull it apart, and you draw like a mind map on a microbiome report. You go, okay, this could be this could be that. So it does provide a lot of information.
Yeah, I really resonate with so much of what you said there, like that it is just a piece of the puzzle, like, or a piece of the solution in terms of giving us those clues. I mean, we get a lot of messages or comments from our members or messages on Instagram saying, my child's got this, like my child's got candida, or my child's got whatever it might be. And when you kind of dig into, hang on a minute, how do you how has that been diagnosed? Often it is, it's been incorrectly diagnosed, or it's been assumed by either the parent or maybe a health practitioner, based on like one thing. So I love that rule of threes, and not getting stuck on, like one part of the test giving us, this kind of solution or diagnosis. So I think that's really helpful. And that constipation example was a really good one. And another thing we see really commonly is like eczema. So using that as an example, like how can a gut microbiome test or the results of a gut microbiome test like help explain something like eczema, as another example?
And this is, we're now getting into the nitty gritty of the big question: should I measure my child's microbiome? Now, it's an interesting area, and I've collaborated with a number of experts in the field who specialize in infants care, especially in relation to researchers around infants and the microbiome. What we know to date is the largest amount of research in relation to the microbiome is in adults. Yeah. And unfortunately, it's actually going to be in adult men. I mean, we won't go down to the whole debate of researchers back in the 70s and 80s said females are too difficult to do research on because of their menstrual cycle. We're just going to do research on men. And that's just skewed a whole pile of research. So a lot of research is actually based on adults. Now, the biggest thing we've got to consider are our children are not little adults. They are their own ecosystem. They are their own individuals, and we can't just treat them as, miniature adults or miniature us. Yeah. So I do raise a degree of caution when it comes around to measuring the microbiome in children. There are a number of very experienced practitioners who are doing this and who are excellent in what they do. So it does come down to experience. The other thing to note here is the age. Now, I've looked at the research at how accurate measuring the microbiome is in children under the age of 2. And what's quite fascinating is 2 particular markers within the gut called zonulin and calprotectin. So zonulin is a protein that's linked up with this concept of leaky gut. And calprotectin is another protein that indicates inflammation. So what can actually happen within that first 2 years of life when the microbiome is developing and becoming stable? Both zonulin and calprotectin can be all over the place. I'm talking one day it's very high, a week later it's very low. And I've seen it where parents bring in a microbiome report from a previous practitioner of their 1-year-old, and they come in and go, my patient's got leaky gut, they've got inflammatory bowel disease, or they've got calprotectin. And I explain it to them. I'm like, well, it's actually a very difficult thing to accurately evaluate because these markers do go up and down. And I've seen that a number of times. So we do need to be cautious on that one. Once you're getting above that age of 12, then things start to stabilize a lot more. And I do measure the microbiome in teenagers, and that does reflect quite nicely to adults in a particular way. But linking this up with things like constipation and eczema, one particular marker that we can evaluate is going to be bifidobacterium. So this is really interesting because as adults, we don't necessarily need bifidobacterium. But as infants, it is the dominant species within the microbiome, this bifidobacterium. And the reason why it's the most dominant species is because of breast milk. Within breast milk, you've got all of these different amazing compounds. One of them is called HMOs, human milk oligosaccharides. It's a type of prebiotic fiber which helps to feed up the microbiome and responsible for bringing up bifidobacterium in those young children. So I do look for bifidobacterium in those younger children because I know that that's what we're looking for. We're looking for a gut that's dominating in those particular species.
Yeah, such a good point. And I'm really glad that you brought that up in terms of that, testing the gut microbiome in children, and that we're, I guess the healthy reference ranges are based on adults. So we really need to take that into consideration and like as practitioners. And we've had that experience before where, clients will bring us, microbiome testing that they've had done with other practitioners and be like, oh, what's happening here? And they weren't really aware. So I think there needs to be more awareness around that in the practitioner world as well, because it's like, that there's a lot of misinformation that can be shared,
We
isn't
need
there?
more research. Unfortunately, because the microbiome of an infant under the age of 2, it's not stable. And so it fluctuates so much. And so it's difficult to understand what is normal when it fluctuates so much. And there isn't, from a commercialization perspective, young children, there isn't as much money to be made from a commercial perspective to put money towards research. And then also from I'll put my researcher hat on, measuring infants' microbiome, it comes with a whole nother layer of ethics. It comes with a whole nother layer of complications on, they get sick often. Are they breastfed? Are they not breastfed? Are they born vaginally? Are they exposed to the environment? There's so many confounding factors. And from a researcher, you want to do a research study that hopefully improves the community and improves lives, but you want a result at the end. You want something to say, yes, our research showed this, or otherwise you're not going to get funding in the future. And that's why a lot of researchers, they focus on what they know will actually provide research at the end of it.
Yeah, that makes so much sense. And I guess on the flip side, like, we were both talking off air that we do use gut microbiome testing in children because it really, like, I guess it's just the practitioner's job to make sure that they're aware that it's, that those healthy ranges are based on adults. Because I know for us, we find that there are still some really, helpful insights that we can get from microbiome testing for kids. So yeah, I think it's a conversation we need to keep having. And like you said, research needs to, happen in that area. Um, so are there any particular symptoms or conditions that you would, I guess, say that strongly indicate the need for gut testing?
Mm. And this is a question that's almost like, how long is a piece of string? So, of course, straight away, listeners are like, well, gut symptoms. And yes, if someone presents with diarrhea, constipation, bloating, reflux, pains in the stomach, yeah, straight away, we're going to be doing a gut test. But because the gut is linked up with so many different systems within the body, this list actually grows hugely. And about 90% of my patients, before they see me, will do a gut microbiome test, regardless of what they're presenting with, because it provides so much information. A couple of things that I use within clinical practice will be food sensitivities. So if a patient says, I can't tolerate legumes, or I'm having a reaction to particular foods. So a restrictive diet is going to be another example. Even skin conditions. So yes, eczema, dermatitis, psoriasis, anything that's presenting on the skin, I'm straight away thinking, let's measure the microbiome. Other examples will include hormones. So we alluded to this at the beginning, things like PCOS, endometriosis, but even fertility and pregnancy. So we've got to think about where is the microbiome coming from in that first instance of life. And that's going to be from the mother's vaginal microbiome. So we really want to ensure that the mother's health is of tip-top shape before giving birth, especially in that last trimester where we can modify the microbiome, which will thereby go on to modify the vaginal microbiome and colonize and inoculate the infant's microbiome with healthier species. The hormones, another one, immunity. At the moment, it's middle of winter. And so immunity, every second person I speak to is sick or coming down or got a family member that's sick. We've got to remember almost 70% of our immune system is situated within our gut. So we've really got to take care of our gut if we want to have a healthy immune system. Another one is going to be autoimmune conditions. So when I say autoimmune conditions, I'm talking everything from inflammatory bowel disease, like ulcerative colitis and Crohn's disease, to arthritis, to multiple sclerosis, to type 1 diabetes, to celiac disease. Any autoimmune disease, I will always measure the microbiome with. The other one would be mental health. So anxiety, depression can give us clues as to what's going on within the gut. And I think the last one that I'll say is general health. And I actually have probably about 10% of my clientele. I refer to them as the worried well. They don't really have much going on. They've heard about gut testing and they just want to make sure everything's okay. And there's little things that we can do to tweak their microbiome to ensure it is optimal. So general health, call me biased because I specialize in this area, but I measure my microbiome every year. Every year I do a check-in to go, how am I going? My wife, I'm like, oh, it's that time of year again. And I measure her microbiome. I measured her microbiome after like 2 or 3 weeks of dating. I said, hey, let's measure your microbiome. Things got very intimate. And what's quite fascinating, bit of a side note here, is you can have what's referred to as a dominant microbiome. So me being, a bit of a health guru, I've got the dominant microbiome in our relationship. Now, we looked at her microbiome when we first started dating to now, together 5 years, married and so forth. Her microbiome has actually morphed into my microbiome.
Wow, this is such an interesting area, isn't it?
So yes, it's not just our own microbiome that we need to be thinking about. We need to be thinking about our stubborn, unhealthy husband who eats takeaway food. I'm generalizing here.
Yes.
But we've got to think about our partner's microbiome as well, because that's going to impact your own microbiome, the kids' microbiome, the whole family's microbiome. So it's quite common, and maybe you can relate to within your practice. Once you see one family member, then the other family member and it's almost like you're treating the entire family. And really, that's what we should be doing. We should treat the whole family, treat their home, treat their whole diet, because that's where, that next step in optimal wellness is actually going to occur.
Yeah, and it's so interesting when you are treating families and getting those gut microbiome tests, like the similarities in family members can be really fascinating as well, can't it?
Yes.
So was testing your now wife's microbiome part of your is she the one kind of decision?
I did evaluate it. I mean, she's an incredible individual, but we're very lucky because both of her parents are integrative GPs. And so she's been along to all of these health conferences around the world, for that better part of her life. And we won't go into her too much. But health and gut health was a big thing. I think for our first Valentine's Day, I got her a squatty potty. So a stool that goes by the toilet. So you put your feet on it to help with constipation. She thought it was very funny. So if you're looking to get something for your partner for Valentine's Day, I can highly recommend a stool for the toilet.
Very good advice, depending on who your partner is. I love it. Okay, so I know I could sit here and talk to you for hours. I just want to touch on how accurate testing is, because this is a question we often get. Can you talk to that?
Yeah, definitely. And it comes down to which microbiome test you're utilizing. The microbiome test from the GP, it's raw, it's basic, it's looking for a pathogenic infection causing diarrhea. Okay, it's not a microbiome test. It is a pathogen test. So the two very different things. So sometimes I have patients saying, oh, I've had my microbiome checked. Here it is. And it's the report from the GP. And I'm like, that's not measuring your microbiome. That's just looking for a couple of pathogens. It comes down to the type of technology used to measure the microbiome. So there's different tests available, different technologies available to measure the microbiome. The most comprehensive is something called metagenomics or shotgun metagenomics. Basically, it's where we look at the DNA of the bacteria, where you've got other testing methods, which are still available here in Australia. I don't know why, which include things like culture, where they try and grow the bacteria. I'll give you this stat. Only about 5% of the microbiome can be grown. So if we utilize a microbiome test that is culture, where you're trying to grow the bacteria, we're only looking at about 5% of the microbiome. Where if we do this metagenomics, or where we look at the whole microbiome, we're looking at 95% of the microbiome. We're looking at so much more. So that's one big thing. So on a microbiome test, as a patient, you want to ask your practitioner, is it metagenomics? Does it measure for diversity? Does it measure down to the species level? Does it look at the function and the metabolites of the microbiome? Does it look at the environment of the microbiome? Because it's not just about these keystone species, lactobacillus and bifidobacterium. There are so many different species we're looking for, and it comes down to the type of technology used in a test. So yeah, that's the big one. The other thing that I'll mention here is there's been studies to go, well, hold on. If I measure my microbiome on a Monday, Tuesday, Wednesday, Thursday, Friday, how accurate is it in that sense of will it show the same results? And it does. When you're utilizing this accurate form of measuring the microbiome, you can measure your microbiome every single day and it will show the same thing.
And it will be the same, yes.
But if we do treatment interventions, so changing up the diet and putting in prebiotics and probiotics, within a couple of weeks, we can drastically change the microbiome and it can give us clues as to what's going on. So microbiome test is very accurate if it's the right type of testing. If it's an older style of measuring the microbiome, then no, it's you've got to take it with a grain of salt, and a lot of the information you'd question a little bit.
Yes, like anything, like there's not all tests are created equal, and you definitely want to go through, a qualified practitioner who knows, what they're doing and has experience in gut microbiome testing. Yeah.
I'll give you the example of cholesterol or iron. When you go to the GP to measure iron, if they just measure ferritin, us as practitioners will go, hold on, this is just one marker of the 3 or 4, 5 other markers that we want to evaluate. We want to know B12, we want to know folate, we want to know red blood cells, we want to know saturation of iron, all of these different components. Just like cholesterol, we don't want total cholesterol. We want a breakdown of LDL and HDL and lipids and so forth. So it really comes down to the quality of the test, and that is what's going to determine whether or not it's accurate.
Yes. Oh, you've explained that so well. So really important, because there are tests that you can just order online yourselves and those sorts of things, which are not the test you want to go for.
Yeah. And the test is only as useful as the practitioner interpreting it. So I strongly advise the general population and patients not just to order a test online, because you really need a practitioner like your team to be able to interpret it, prescribe the right intervention, and then follow up and go, okay, what's the next step? Because it's not just one moment in time. It's this ongoing journey for optimal health.
Yeah. So well said. And so what is the best course of action, once people have their microbiome testing back, once you've identified some issues, like what's next?
My number one piece of advice here is to work with a practitioner. From there, your practitioner will utilize the results in the microbiome test, evaluate your clinical history, your dietary intake, evaluate you as an individual, maybe some bloods as well, maybe some other testing, combine that information and create a tailored, personalized approach. And of all of the pre and post interventions I've seen, the most effective outcome when it comes around to treating the microbiome is working with a practitioner. Now, here's going to be the biggest caveat, and one that practitioners, and I'd love to know your thoughts on this, practitioners are still realizing and learning. and that is the concept of retesting. So a lot of the times practitioners will test once, do a treatment plan, and then we as practitioners would almost forget to retest. But I've now implemented it in my practice where after 4 months, it's retest. And it is incredible what the retest shows. It will provide further direction. It will reconfirm what interventions we are already prescribed, or it might say, hey, this intervention is not working. And believe it or not, probably about 30% of the time, and I can reflect back on this and I can acknowledge this, 30% of the times, you prescribe an intervention where based on the research, based on previous experience, you would think, yes, this would change the microbiome, but it doesn't. And we've got to reevaluate that microbiome to see what's actually happening. And I've actually become, yes, I've become a better practitioner because of retesting, because I trial different things and I'm really invested in their microbiome to go, well, what's going to be the next best step? So I can't overemphasize enough the importance of actually retesting. What are your thoughts here in relation to retesting the microbiome?
Yeah, well, I was just like, yeah, I think we could definitely do a better job at that, like retesting sooner. We are leaving it longer than that for sure. And I think it needs to kind of become a process for everyone to retest that sooner. So that's actually really good to hear. I'll have to something we need to, I think, change in terms of our protocols.
And it's one of those things, 4 months, how I've narrowed it down to 4 months. Because of my own PhD research, where we researched the right length of time for a gut protocol and retesting both practitioners, patients, they said 4 months. But then I've done my own clinical experience where I've waited 12 months. And it's like, oh, hold on, I've missed something, where I've actually missed something, and I've caused the patient to have a slower improvement in their health. But then I've also tried retesting at 6 weeks, and it's just too soon at 6 weeks. So I've really found 4 months is that perfect time. And so maybe this is a call to action for patients. If you've had a microbiome test done in the last year or 6 months, reach out to your practitioner to say, hey, I would like to do a retest to check in to go, has that intervention worked? How are you sitting now?
Yeah, and I think that's a really good reframe because it can get expensive, and especially with the current economy and families that might have things going on with multiple children, like it can be difficult to kind of, I guess come up with the funds to do that retesting. But I think the way that you put it, like, you could be on the wrong path or missing something, and that could mean like supplements that are unnecessary or aren't, having the effect that you are wanting. So yeah, it's thinking about it in that different way, I think, as well.
And I like to view it where it's an investment in yourself. So then you've got the capacity to work more and to earn more. So a classic example is when a patient comes in going, I can't go to work, I'm too sick. My goal is to get them back working for their own personal reasons, but you need to. So if we can actually identify what's going on and treat it and get them back to work, and then let's maybe take the example of parents. If we can address what's going on in our children, then that burden on the family potentially would be less, thereby whether it's a one income household or two income household, that can then increase and you actually make more money for the whole family.
Well, and especially like a lot of mums might be casual workers. So if they have to stay home with the kids, they don't get paid for that day. So yeah, it is like looking at it from that bigger picture as opposed to the couple of $100 you have to come up with now for the test. So yeah, thank you for bringing that up because this is definitely a conversation I'll be having with our practitioner team in terms of that retesting sooner. Now, before we go, I know you've sort of already alluded to this, I think, but I want to know what your number one intervention is for children's microbiome health.
Mm-hmm. And although every child is an individual and, broadly speaking, I can say my number one intervention that I utilize within clinical practice is going to be these HMOs, these human milk oligosaccharides, because they feed up the bifidobacterium. They prevent pathogens from attaching to the lining of the intestines. They support with leaky gut. They're very gentle. They're affordable. And it's what's naturally found within breast milk. And so, we're sticking with Mother Nature in a sense, where we're just providing, just in a higher dose, what would have been found within breast milk and in some formulas as well to help feed up and modulate the microbiome.
Yes. Love it. Thank you. Thank you for sharing. And yeah, more formulas are having, better levels of these HMOs added to them, aren't they?
Yes, they are. Slowly, it really comes down to the dosage. Ideally, depending on the age, you're looking anywhere between 1,000 to 1,500 milligrams per day, depending on the individual. But within breast milk, you can find anywhere between 2,000-3,000 milligrams of these HMOs.
Yeah, one of the many reasons that, breast milk is so valuable for our kids' microbiomes.
100%.
Thank you so much. I could sit here and pick your brains for a couple more hours, but I know you're a busy man. So can you finish off by letting people know where they can find out more about you and what you offer?
Yeah, definitely. So you can follow me on my socials, Dr. Brad Leech, that's Leech. And I post a lot of content in relation to gut health and the microbiome. And then I've got a number of different educational courses and I see patients and you can visit my website, drbradleech.com.
Beautiful. We'll make sure all those links are in the show notes so people can find you easily. Thank you so much again for joining us and sharing your wisdom, Brad.
Jess, it's been an absolute privilege and I've thoroughly enjoyed it.
Thank you so much for joining me on the podcast today. Head on over to our website, naturalsuperkids.com, for the show notes for this episode, as well as a whole heap of inspiration to help you raise healthy and happy kids. I'll see you next week.